Dear parents, if you have a premature child, then congratulations, and that is such a proud and precious moment for you. Now, here are three things that you would need to do for their eyes, for your precious baby's eyes, in the first 1 year of life. The first thing is getting an ROP screening or a retinopathy of prematurity screening before 30 days of life, especially if your baby is less than 2 kgs body weight or was born before 34 weeks of gestation. Why is that? That is because almost 4 to 10% of premature babies develop ROP. Now, not all ROP needs to be treated, but all ROP needs to be diagnosed. If your baby needs treatment, they will undergo laser, and that will be sight saving for them. The second thing that you want to do for them is to bring your baby for a 3.5 months visual evaluation. Or why is that? Almost 21 to 47% of babies who are premature develop something called cerebral visual insufficiency. This has nothing to do with the ROP. This has nothing to do with the retina even. It is based on the perfusion or the oxygen or the blood supply that the baby's developing brain has got in the few weeks of being born. And this is something that we can check and talk about at 3.5 months of age. The third thing that you want to do for your baby is get their refraction checked at the age of 1 year. Why is that super important? That is because premature babies have a 20% higher chance than normal babies to get high myopia or myopia. What is more scary is that almost 4% of babies have really high myopia above -6 at the age of 1 year, which we can get checked and screened at the age of 1 year. Now, what is even more important is that if your baby had ROP and has got laser, then definitely you should get a pediatric ophthalmologist to check the number at 1 year, because almost 18 to 82% of babies who've had laser develop myopia at the age of 1 year. This is not to scare you. This is only to embrace the opportunity to treat your baby at the earliest and give them a bright future for the rest of their life. Share it with someone who needs it. So you might be thinking, how is the baby going to be checked? The baby can't speak, the baby can't say if they can see or not, and how are we going to check their eyes? So we use something called a handheld retinoscope and an indirect ophthalmoscope to find out if they have glasses number, if they have refraction errors, and so much more. So don't be scared. Take your child to a pediatric ophthalmologist.